Hafide and welcome to the first Guam Early Hearing Detection and Intervention Guam GEHDI Virtual Workshop Series. Before we begin the presentation, get a notebook and pen to jot down notes, comments, or questions you may have. You may hit the pause button now. You may send in comments or inquiries to wisticm@triton.uog.edu. Remember, you can always pause the slides at any time if you need to take a break. Today's workshop is an introduction to Guam GEHDI and the Joint Committee on Infant Hearing JCIH 136 plan. If you are viewing this as a professional, a deaf adult, a caregiver, a parent, or a family member of a child identified with a hearing loss, we hope you walk away with a better knowledge and understanding of the hearing screening process and the importance of the JCIH 136 plan. Who are the faces of GEHDI? Let's meet them. One of our partners is Guam's Positive Parents Together, also known as GPPT. GPPT is a nonprofit organization whose mission is to support and empower families who have children with disabilities. GPPT facilitates a parent support group for parents of children identified with a hearing loss. Anne-Marie Cruz is the board president and is also a parent of a deaf plus adult. You can contact GPPT at 777-7991 or email them at guamparents@gmail.com. Another one of our partners is Deaf and Hard of Hearing adults. These adults receive training in the Sky High Deaf Mentor Program. The Sky High Deaf Mentor Program is an intensive 3-day training to learn how to work with families as they navigate a new world with their DHH child. To learn more about the Sky High Deaf Mentor Program, visit their website at deaf-mentor.skyhigh.org. Meet the GEHDI team. Starting from the top row from left to right is Michelle Agagi, GEHDI Director. Janika Ballista, who manages our Facebook page and assists with handling the 2018 National Award-winning Guam GEHDI website. Next row, left to right, Marie Wistic, GEHDI Coordinator, and the Family Engagement and Support Coordinator. Joseph J.J. Mendiola, our Quality Improvement Coordinator. Bottom row left to right, Tanya Simmer, Hearing Screening Facilitator. Dr. Renee Coffin, our GEHDI Audiologist Consultant. And Ruth Leon Guerrero, our GEHDI Office Technician. The history of Guam GEHDI. The Guam GEHDI project is 100% federally funded and established in 2002 through a federal grant awarded to the University of Guam Center for Excellence in Developmental Disabilities Education, Research, and Service by the U.S. Department of Health and Human Services, Health Resources and Services Administration to establish Guam's newborn hearing screening and intervention program. It also received funding from a cooperative agreement from the U.S. Health and Human Services, Health Resources and Services Administration, and the Centers for Disease Control and Prevention. Public Law 27-150, passed in 2004, strengthened Guam's newborn hearing screening program. On December 20, 2004, the 27th Guam Legislature passed Public Law 27-150, also known as the Universal Newborn Hearing Screening and Intervention Act of 2004, and became law on December 30, 2004. The passage of this law ensures all children born on Guam have access to newborn hearing screening before leaving the birthing site. Guam GEHDI facilitates newborn hearing screening and intervention on Guam by developing screening, referral, and reporting protocols, tracking and monitoring newborn hearing screening process through Guam ChildLink GEHDI, ensuring the Joint Committee on Infant Hearing goals are implemented. These goals are also known as the 136 Plan. supporting deaf and hard of hearing families through a partnership with a family support group whose mission is to empower families to become advocates for their child, and partnering with deaf and hard of hearing adults in the community. I will briefly discuss what this means in detail and provide additional information as we progress with this workshop. GEHDI works collaboratively with its partners to develop the screening, referral, and reporting protocols and procedures for the newborn hearing screening process. The work we do improves early identification of infants with a hearing loss and ensures early intervention services received by 6 months of age. Our agency partners include the Department of Public Health and Social Services, Guam Memorial Hospital Authority, Sago Manyango Birthing Center, Guam Department of Education, Special Education, Guam Early Intervention System, also known as GEHDI, GDOE Audiology, and Guam Hearing Doctors. Our agency partners make up the GEHDI Advisory Committee and the GEHDI Learning Community. Parents of DHH children, DHH adults, and pediatricians also make up the GEHDI Advisory Committee and Learning Community. If you are interested in becoming part of our GEHDI team, call us at 735-2466 or send an email to wisticm@triton.uog.edu. In 2002, Guam Cedars applied for and received funding through a cooperative agreement with the U.S. Department of Health and Human Services, Centers for Disease Control and Prevention, establishing an integrated data tracking and surveillance system to support the GEHDI project. Guam received training and technical assistance from the University of Maine to develop the data system known as Guam ChildLink GEHDI. This web-based data system, directly accessed by users from GMHA, Sago Manyango, GEHDI, and Guam Hearing Doctors, holds data from all 3 civilian birthing centers, Guam Hearing Doctors, and GEHDI. Users trained enters demographic information, initial and outpatient hearing screening results, diagnostic audiological evaluation results, and enrollment in early intervention services. So why is it important to screen babies' hearing? Language development begins early in a child's life. It begins in the womb. The optimal age for brain development is the first 3 years of a child's life. Babies can hear sounds in their mother's womb as early as 18 weeks. At 24 to 25 weeks old, they can recognize mom or dad's voice. Newborns identified with a hearing loss as early as 3 months of age can receive early intervention services and fitted with hearing aids to help them achieve speech, language, and social-emotional milestones equal to or close to their peers. Early intervention services should begin before your baby is 6 months old. Up next is a short video which explains how newborn hearing screening helps children.
The first year of life is a crucial time for your baby. Did you know that your baby's brain doubles in size in the first year of life? During this time, the brain is forming connections for important skills like learning language. 2 out of every 1,000 babies may need some extra help with this because they're born deaf or hard of hearing. It's important to find hearing loss as soon as possible because babies start learning how to communicate as soon as they're born. Sounds, facial expressions, gestures, and signs are all building blocks for communication. If hearing loss is found early, children and their families can get help developing communication skills. You can't tell for sure if a baby has hearing loss just by watching them. A baby who is deaf or hard of hearing may cry or seem to react to sounds just like other babies. 95% of babies identified with hearing loss are born to hearing parents. Only a hearing test designed for newborns can tell you if your baby is deaf or hard of hearing. Newborn hearing screening is a safe, painless test and can be done in about 10 minutes while your baby is sleeping. Tiny earphones are placed in or over the ear, and soft clicking or beeping sounds are played. The equipment measures a response to the sound from your baby's ear or brain. If your baby does not pass the newborn hearing screening, it's a good opportunity to find out more about how your baby hears. You can do this by making sure the screening is done again, usually 2 weeks later. If your baby doesn't pass the screening again, an audiology clinic for children can perform a full hearing test. The audiologist will find out why your baby didn't pass the screening. Some families find out it was because of a temporary blockage in the ear. Other families learn that their child has permanent hearing loss, and they begin their journey learning how to help their child. These families are offered early support services, like hearing aids and sign language, that help deaf and hard of hearing children be successful. They also meet lots of specialists and other families of children who are deaf or hard of hearing, who are all there to support them on their journey. Studies show that the sooner you give children the help they need, the better they will learn speech and language, the better they will do in school, and the better they will do socially and emotionally as they grow up. It's important to know that even if your baby passes a newborn hearing screening, it's still possible for hearing loss to show up later. Watch for signs of hearing loss as your baby grows, and talk with your baby's doctor if you're worried. You know your child best, and you are the best person to make sure they have the care they need.
The Joint Committee on Infant Hearing released its 2019 position statement, Principles and Guidelines for Early Hearing Detection and Intervention Programs. Today, we will focus on the JCIH 136 plan and how it works with our partners. To learn more about the JCIH, visit their website at www.jcih.org. The JCIH 136 plan is a guide for our partners and parents to ensure infants are identified as early as possible and receive early intervention by 3 to 6 months of age. Step 1. Babies are screened before 1 month of age. Step 2. Babies receive diagnostic audiological evaluation before 3 months of age. Step 3. Babies identified with a hearing loss enrolled in early intervention services by 6 months of age. How does this work? As mentioned in the previous slide, all babies born on Guam receive a hearing screening before leaving the birthing site. Let's learn how to ensure our babies receive services on time. First of all, to meet the first benchmark, babies screened before 1 month of age, we ask that you do the following. Ask the nurse at the birthing site how your baby did on the hearing screening. If your baby passed the initial hearing screening, congratulations! No further testing is needed. Continue to monitor your baby's hearing. Should you have any concerns, contact your baby's pediatrician. If your baby did not pass the hearing screening at GMHA, you will be given an appointment for an outpatient follow-up hearing screening before you leave the birthing site. This appointment will be at the GDOE Audiology Office in Tizen. Keep this appointment. This hearing screening should occur before your baby turns a month old. Call the screening site and reschedule if you are not able to make the appointment. If your baby did not pass the hearing screening at Sago Manyago Birthing Center, you will be given an appointment to return to the center for an outpatient follow-up hearing screening. Keep the outpatient follow-up hearing screening appointment. This appointment will determine if a diagnostic audiological evaluation is needed. If your baby did not pass the outpatient follow-up hearing screening at Tizen, you will need a referral for a diagnostic audiological evaluation. GEHDI personnel will assist you with this process. If your baby did not pass the outpatient follow-up hearing screening at Sago Manyago Birthing Center, your baby will receive a referral to GEHDI for a diagnostic audiological evaluation. The next step in the hearing screening process is the diagnostic audiological evaluation, also known as a DAE. This next step is essential in determining if your baby has a hearing loss. A diagnostic audiological evaluation by 3 months of age is met by doing the following. After your baby is screened at the outpatient follow-up hearing screening, you will receive the results of the hearing test. If your baby does not pass the hearing test, the next step is a referral to an audiologist. Parents or caregivers schedule an appointment with the audiologist at Guam Hearing Doctors. If you have insurance, you will need a referral from your primary care physician. Inform your private or public clinic that your baby did not pass the hearing screening and requires a referral to the audiologist for a diagnostic audiological evaluation, DAE for short. Once you receive a referral to the audiologist, call and make an appointment as soon as possible. Remember, an audiologist is the only doctor who can diagnose a hearing loss. The audiologist has specialized equipment and expertise that can determine hearing loss. Your pediatrician or personal doctor cannot diagnose a hearing loss. Make your appointment to see the audiologist as soon as possible. See the audiologist before your child is 3 months old. The final step in the hearing process is early intervention. To meet the next benchmark, babies identified with a hearing loss enroll in early intervention services by 6 months of age. We highly encourage families to do the following. After the audiologist identifies a hearing loss, learn what services or interventions are available to help your child achieve their speech, language, and social-emotional developmental milestones. One of the services available for infants ages 0 to 3 years of age and their families is the Guam Early Intervention System, also known as GEHDI. They provide services and support to young children birth to 3 years of age who have or are at risk for developmental delays and disabilities. They offer numerous services but are not limited to the following: developmental assessments, individual family service planning, home visits and therapy, parent education and support, and service coordination with other local agencies. Early intervention services are provided in the child's home or community settings, such as child care centers, playgrounds, beaches, etc. You can also ask GEHDI to connect you with a parent support group for parents with children identified with a hearing loss. Parents in this support group are willing to share their experiences raising a child with a hearing loss, what it was like to receive services from GEHDI, and just enjoy the company of other families like themselves. The GPPT Family Support Group can also help guide families through a system that may feel overwhelming at times when you first receive the news of your child's hearing loss. They have real-life experiences, access to tools that can help you and your family decide how to best communicate with your deaf and hard of hearing child. They are always respecting your decisions for you and your family. Up next is a short video that provides a quick view of the newborn hearing screening process. We hope you enjoy and learn from this short clip. We hope that after viewing the video, you have a better understanding of the newborn hearing screening process and why it is important to screen babies before leaving the birthing site.
Every year, 1 to 2 babies in every 1,000 are born with a hearing loss in one or both ears. It is important to establish whether a baby can hear because early identification is known to be important for the development of the child. The sooner we know a baby has a hearing loss, the sooner we can provide the help and support needed for both baby and parents. The newborn hearing screen is offered during your stay in hospital, when a member of the hearing screening team will visit you to discuss the screen and to answer any questions that you may have. It is now possible to screen babies' hearing when they are only a few hours old. The screen takes just a few minutes. It is very reliable. It is not upsetting for you or your baby. The hearing screen is usually offered during your stay in hospital, either on the labour ward or on the maternity ward. Before screening takes place, you will be asked for your consent. The screen will usually be carried out at your bedside when your baby is comfortable and settled. This baby is being screened using the automated auto-acoustic emission screen, also known as the OAE. For this, a tiny soft earpiece is placed in the baby's ear, and a sound like this is played. A hearing ear will respond to these sounds by making a very quiet sound that can then be picked up by the microphone in the earpiece. The whole process has only taken a couple of minutes to complete. The baby remained peaceful throughout, and the screener has been able to record clear responses from both ears. The screener makes a note of the screening results in the baby's records and shows Mum 2 checklists in the red Child Health Record book to refer to as baby grows. One details the reactions to sounds a baby should be making at a given age, and the other details sounds baby should be reacting to at a given age. The screener is happy with the responses received today, but a very small number of babies may develop or acquire a hearing loss later on in life, so it is important to keep a check on your baby's hearing. If you have any concerns at any age, tell your GP or health visitor. Most babies will have the hearing screen before they leave hospital. If your baby is not screened before you leave, or is not born in a hospital setting, you will be offered the newborn hearing screen before your baby is 4 weeks old. This will usually take place in an outpatient's clinic. Clear responses can be recorded from the OAE screen for most babies who can hear, but for a number of babies this may not always be possible. Because of noises in the room, the baby may become unsettled, or there may still be some birth fluid in the ear which would clear over time. This baby had an OAE screen earlier this morning, but the hearing screener was unable to get a clear response. The screener will explain this to Mum and will explain the second screening technique with her. Once the baby is settled and preferably asleep, this next screen can begin. It's called the Automated Auditory Brainstem Response, known as the AABR. This time, the baby's responses to sound are picked up through small sensors, which are placed on the neck, shoulder and forehead. Soft clicking sounds are played through earmuffs, especially designed for newborns. This screen can take up to 20 minutes to complete, during which time the baby's responses are automatically measured. Again, if the room becomes too noisy or the baby is unsettled, it might not be possible to get clear responses, so some babies might need to be referred to children's audiology for further assessment. It is likely, though, that the clear responses will be recorded at this stage, but just in case there is a hearing loss, it is important to keep any appointments made for you and your baby. Babies who have spent longer than 48 hours on the neonatal intensive care unit will be screened using both techniques, as these babies have a higher risk of a hearing loss. As we have seen, identifying hearing loss as early as possible is important. Screening is quick and harmless. Your baby's hearing can be screened within a few hours of birth. Information and help is available at every stage. If you have any concerns about your baby's hearing at any age, please contact your health visitor or GP. Newborn hearing screening makes a difference.
Before we end, let's talk about how you can help your DHH child or families of children identified with a hearing loss. If you're a parent with a DHH child, enroll in GPPT's Parent Support Group. If you're not a parent, you can still help by letting families know about the Parent Support Group or volunteering your time and talents to GPPT. Guam Community College American Sign Language students have participated in family events practicing and teaching families ASL. Having DHH adults lead in helping families learn ASL is a great way to help children and families communicate. Be an advocate for newborn hearing screening by informing friends and families of the benefits of infant hearing screening and continuously monitoring a child's hearing throughout their growth and development. If you are a parent of a DHH child, have a sibling with a hearing loss, we welcome you to join the GEHDI Advisory Committee. Encourage parents or friends to go through the hearing screening process and keep all their appointments. Hearing loss is invisible. Only an audiologist can determine if there is a hearing loss. Keep all appointments. Be part of the deaf community. These wonderful adults bring lived experiences. Research supports the value DHH adults bring to families when they share their life experiences and the deaf culture. If you have any questions, contact or visit us and our partners. Guam Early Hearing Detection and Intervention at 735-2466. Email at nennyhearing@guamcedars.org or visit the website at www.guamedi.org. Guam Early Intervention System at 300-5776. Email at gees@gdoe.net or visit the website at www.gdoe.net. Guam's Positive Parents Together at 777-7991. Email at gppt@gmail.com or visit the website at guamparents.org. Thank you for participating in today's Guam GEHDI virtual workshop. Please take a few moments and click on the link below to complete the evaluation. Thank you, and si duas masi.